Relapsed mantle cell lymphoma, I think really kind of depends on what the prior therapies were. As we're currently getting into an era where more and more patients are seeing novel therapies such as BTK inhibitors, the big question is, have they seen those therapies in the past, or are they just relapsing after chemoimmunotherapy? Most patients as of right now would have relapsed after just chemoimmunotherapy. But those who may have been exposed to BTK inhibitors may need a little bit more thought process, because those who have just received chemoimmunotherapy is very clear that the BTK inhibitor is the standard treatment option in the second line setting. For those who have received a BTK inhibitor in the past, the question then becomes, did they respond well to it, and did they have any toxicity to it? If they responded well and were stopped because of a planned hold in therapy for whatever reason, then I personally think it's reasonable to try a BTK inhibitor again. If not, or they progress during BTK inhibitor therapy, then ideally we would think about novel agents, including CAR T cell therapy. We often use venetoclax for bridging for CAR T cell therapy, with some caveats that sometimes venetoclax may need to be held for collecting of the CAR T cell therapy. But also age plays a role into some of the decisions about CAR T cell also. So if a patient is not eligible for CAR T cell therapy, then I think a non-covalent BTK inhibitor like pirtobrutinib is a very reasonable choice. After that, we have other therapies to consider, such as lenalidomide, bortezomib, and some more novel therapies that are coming out, including bispecific antibodies.